Health continues. I'm Mark Alyn. A little bit later in this episode, we'll be talking about another new book, and that's a book by Daniel Miller, which is about accepting everybody, no matter what they are or who they are. It's called The Gifts of Acceptance, Embracing People and Things as They Are. Later on in this episode of Late Night Health, we go back to New York City as we're talking about marijuana, medical marijuana, and we've been talking about CBD. I want to talk just very briefly about CBD before we go into what medical marijuana can do and how you get your doctor to prescribe it. I know it's different state by state, but last week or within the last 2 weeks, I was in a health food store in Ventura, and their CBD shelf was half full. And I asked the clerk, and she said that the health department in Ventura came and removed CBD products, certain CBD products, from the shelves. How do you feel about that, Dr. Thomas?
Yeah, I am. My personal feeling is I believe in that the overreach, and that's my position. That I feel that the DEA, the government, doesn't fully understand the definition and the how we extract by global definition saying CBD is coming from the plant, therefore it is marijuana. You have to take into consideration, does it have psychoactive properties or not, which CBD does not. So I feel that yes, CBD should be over the counter, but at the same time that the manufacturers need to be a governing body to oversee the production for quality assurance, as well as educating community on CBD, because there's certain times of the day, specifically at nighttime, you don't want to give CBD because it's not a stimulant, but it's going to keep you very alert. So the last thing I want to do is interfere with the sleep-wake cycle, what we call the circadian rhythm. So by giving it too late at night, next you know you're having difficulty getting to bed, and now we develop insomnia, and that could bring on other medical conditions or pathology, insomnia.
And I know that again, for 50 years, 60 years, maybe even more than that, people with catastrophic diseases such as cancer and just mind-numbing diseases, and I say mind-numbing because of the pain, and marijuana has been clinically shown to alleviate pain and maybe even have some benefits other than alleviating pain. Can you tell us some of those, Doctor?
Absolutely. My practice, it was when we first opened the doors, it was pretty broad. I am in, my doors are open 4.5 years now. I've certified over 1,000 patients, and I've done a study. So majority of my patients are pain management. I do have cancer patients, multiple sclerosis, ulcerative colitis and Crohn's, what we call irritable bowel disease. But the number one condition would be chronic pain. My patients do very well, and depending on the source of their pain or the type of pain, the type of receptor that's associated with that pain, I would choose what we call ratio of THC to CBD to manage that pain.
And how do your patients take it? Do they smoke, most of them? Do they take it sublingually? How is it delivered?
Sure, the delivery system. Well, I can say it's a generational. The young generation, they prefer a vapor pen, and the onset of action is about 90 seconds, and it lasts about 3 to 4 hours. The middle generation, I'm going to reference my age, 55 plus or minus 10 years. What we call the they have a choice of either going vapor or sublingual drops, because depending on what they feel comfortable with, and that would be the next generation, the golden generation, which would be in the 7th, 8th. As a matter of fact, I just certified a patient today that was 88 years old. They prefer either sublingual or a capsule.
Gotcha. That's interesting to me too.
Yeah.
Because, well, I've said this on the air I don't like this. I don't like smoking. I don't like e-cigarettes. I don't like tobacco, and I don't like being around people who are smoking marijuana. And I'm not a user myself. I have tried CBD for pain management, and it's been sometimes it's successful, and sometimes it's not. But it's self-prescribed from rather than going to a doctor. And we only have about a minute or so left in our conversation. Walking in Venice Beach, you can be approached by people, both men and women, saying, "You look stressed. Come up to our doctor's office. He'll give you a prescription for marijuana." Is that a good idea? Or have you seen that?
No, in New York it's very strict. It's highly regulated. New York's one of the most regulated states in the country when it comes to medicine. Medicine in America is conservative, and then New York State is even more conservative, so it's highly regulated. You must have qualifying condition. If you don't have a qualifying condition, you cannot be certified. And in my office, I screen out the patients before they even walk through the door. If they don't qualify, they cannot even come through my door. So,
Doctor,
no
we are out of time, and I really appreciate your time today. Medical Marijuana, Real-Life Success Stories by Dr. Thomas O'Brien II, and it's available on Amazon. And I think my timing is pretty good. I want you to join us at latenighthealth.com, latenighthealth.com.